now we are going to see about the layers of the abdominal wall, that too mainly anterior abdominal wall. So actually we have 9 layers of the anterior abdominal wall, which includes skin to the last layer of the anterior abdominal wall. Just we will see all the 9 layers now. So first is the skin. This is the outer layer of the abdominal wall. Then superficial fascia. Then all 3 flat muscles of the anterior abdominal wall, that is external oblique muscle, internal oblique muscle, transverse abdominis muscle. And coming to the fascia, transverse fascia, which covers all these 3 muscles, and extraperitoneal fat, which is present between the fascia and the peritoneum, and at last we have the parietal peritoneum. So all these 9 layers comes under the, including these 2 fascia. So totally 9 layers of the anterior abdominal wall. Actually, in superficial fascia we have 2 fascia, that is carpus fascia, camphus fascia and carpus fascia. So these 2 fascia constitute the superficial fascia in the abdominal wall. Whereas deep fascia is absent in the anterior abdominal wall because during pregnancy or during intake of food, some extension can be seen in the anterior abdominal. This extension is due to absence of this deep fascia. Okay. So in skin is the outer protective layer. Okay. So coming to the superficial fascia, we have carpus fascia, camphus fascia and the carpus fascia. Camphus fascia is the superficial layer which consists of fat, which is also known as fatty layer. Carpus fascia, which is the membranous layer, deep part of the superficial fascia. So in skin, in the anterior abdominal wall, we have a important mark, that is umbilicus. Umbilicus is presented in the anterior abdominal wall. Actually in the skin you can able to see the depression over it. So, and as I said, all 3 flat muscles and the fascia, extraperitoneal fat and parietal peritoneum. So all these are the layers. Coming to the clinical significance, we have the mainly carpus fascia. Carpus fascia is normally important, that too clinically, because it is a suturable layer. Actually, this camphus layer, which is presented above the carpus fascia, is not that much strong to hold the suture during the surgery in the anterior abdominal. So carpus fascia does this function. Thank you.